Mohammad Monam Uddin. My home district, my home country is Bangladesh, but I have studied in Malaysia. I am studying in PhD, and I am also part-time lecturer at in Malaysia University. Approximately 7 months ago, I realized I have some problem, breathing problem. When I talking more, that time I was very problem for breathing. Then I will go to 𝐂𝐚𝐥𝐸 Hospital in Kuala Lumpur. Then I will admitted. Then I have admitted under the Dr. Kua. Then Dr. Kua decide in my lung have many many water. Then after approximately 3 days, he will remove my all water from my lung. Then doctor told me you will go to for CT scan. Then I will go to for CT scan. Then after CT scan report, Dr. Kua say Monam, it will be cancer, maybe. Then I will go to for biopsy. After biopsy report, yes, I have cancer, lymphoma. Then Dr. Kua referred Dr. 𝐂𝐚𝐥𝐸 in 𝐂𝐚𝐥𝐸 Medical Center. Then approximately 1 month, I have admitted in Dr. 𝐂𝐚𝐥𝐸, and my first chemo I have started from 𝐂𝐚𝐥𝐸 Medical Center, Dr. 𝐂𝐚𝐥𝐸. Then Dr. 𝐂𝐚𝐥𝐸 told me there have many cost, your bone marrow transplant and your everything cost, chemo. So you will go to India. Any good hospital. Then I decided I will go to India, and my friend told me I have a friend, Mr. Prokhor, and Mr. Prokhor team. So you contact with Mr. Prokhor and you will go to India for your treatment. Then I have contacted that time Mr. Prokhor. Mr. Prokhor suggested you have admitted Fortis Hospital Gurugram under the Dr. Rahul Bhargava, because Dr. Rahul Bhargava is very good doctor for oncologist and haematologist and for bone marrow transplant. Before my admitted, I have seen from YouTube.
Mr. MD Monam is a case of T-cell ALL. He was given chemotherapy at some other centers, and the reason for taking up for the transplant was simple: the MRD was positive. As we know from the Western literature that once the MRD is positive, please keep on listening, which is a very important word called MRD, minimal residual disease. If it is positive once after induction, then the patient becomes on high risk for relapses, and that's why MD Monam MRD was positive 3 times before he was given a chemotherapy. His MRD became negative and he was taken up for a half-match transplant, because we know that if we do not do transplants, there is less than 10% chances of being alive at 10 years. With bone marrow transplant, haplotransplant has given an opportunity up to 70 to 80% that he is going to be fine over next couple of years. The next 3 months are going to be difficult in terms of side effects and other problems which needs to be tackled. But yes, these are the indications where you need to intervene early, and that is why the journey of bone marrow transplant has been smooth for him, because he has been taken up without infection, without any complication or without relapse. So the moral of the story is that bone marrow transplant needs to be done early, and we have to pick up those signs like MRD or high risk mutations to do a transplant so that patient can live a normal, healthy and a long life.
Then approximately already my all chemo done, my bone marrow transplant is already all have done. So now I am happy, and here Mr. Prokhor, Mr. Karthik and every team, and here every staff, every nurse, every doctor have all time helped me. So I am happy for everything, for my treatment. Today is my discharge. Today is 20th February. Is my discharge. Everything is good. Just my platelet is some low. I hope it will be good within 2 or 3 days. Doctor told me So now I am happy, and I am happy also Mr. Prokhor team, because in hospital my bill approximately too much, but Mr. Prokhor told high management and my bill some reduced. So I am happy. With Mr. Prokhor and Fortis Hospital.